Dear colleagues, ladies and gentlemen, let me present you the data or the preliminary study of the features of autoimmune pancreatitis according to the experience of single tertiary gastroenterological center. There are different types of autoimmune pancreatitis in different populations. In Asia, there is predominance of type 1 pancreatitis. In Europe, type 2 pancreatitis. There are focal cases that are diffuse forms of autoimmune pancreatitis with involvement of other organs or isolated affection of the pancreas. Some patients have features typical for pancreatitis or the other etiology like calcifications or pseudocysts. So we analyzed the data of 29 consecutive patients that were followed up in our center up to 9 years. The mean follow-up time was 3 years. There was equal gender distribution. Most of our patients, in contrast to other studies, were white-collar workers. Most of them did never smoke. In most of the cases, there was zero or very low alcohol consumption. And in most of the cases, there was no prior surgery. Only one patient had Whipple resection of the pancreatic head, at which the autoimmune pancreatitis was diagnosed. The mean age at diagnosis was 47 years. There was equal distribution to type 1 and type 2 cases. The mean diagnostic delay was 7.5 months. In most of the patients, there was abdominal pain at presentation, while a quarter were completely asymptomatic. Interestingly, we found out 3 non-pancreatic neoplasms, 1 cholangiocarcinoma, 1 stomach cancer, and 1 lymphoma. According to the radiology, there was predominance of diffuse forms. There were several cases with the development of portal or splenic vein thrombosis, 3 pancreatic pseudocysts, and 1 calcification. Interestingly, only in half of the cases, steroids were required for induction of remission. In 14 patients, there was spontaneous remission without any treatment. Steroids were required in 15 cases for remission maintenance. Half of those are required to shift to thiopurines, and 11 cases remained in sustained remission without any treatment. So the Russian population of AAP patients is characterized by equal proportion of type 1 and type 2 AAP cases. In almost half of the cases, patients develop spontaneous remission without application of steroids. 38% of patients achieved sustained remission. Thank you for your attention.